Well, kia ora koutou katoa. No mau haere mai ki te manatū haora. Welcome back to the ministry today. So I am pleased to confirm there are no new positive COVID-19 cases in the community today. We have got 4 new cases in managed isolation to report. All 4 were identified at day 01 testing. Now, the fact there is no new community case today is reassuring, but clearly we are early on in this journey and not yet out of the woods. Based on last week's exposure events, which are listed on the locations of interest page on the Ministry's website, we would expect to see any potential positive cases coming through from today onwards. In addition, we've just received the whole genome sequencing for case O, that is the mother in the 3rd family in this February cluster. This shows a linkage to the rest of her family and to the rest of the cluster. Another reassuring sign we are not dealing with a separate infection. On the testing front, there were 8,880 tests processed by our labs nationally yesterday. That will reflect largely the volume of swabs done on Sunday, which is a large number for a Sunday. And across the motu yesterday, in terms of swabbing, actually there were around 7,000 swabs taken just in Auckland, and around 3,000 of those at community testing centres, around 4,000 at GP and urgent care centres. We do expect high numbers again today and tomorrow, just from general testing in the community and as our casual contacts from the earlier Kmart and KFC exposure events come back for their follow-up tests. So since Sunday the 14th of February, there have been more than 70,000 tests in the community in Auckland alone, equivalent to more than 4% of the region's population. I want to thank everyone who has been tested. This is fundamental to us identifying if there is any wider spread in the community. 11 community testing centres operating around Auckland today. They can be found on the Auckland Regional Public Health website. And just a reminder, it's important that the right people come forward for testing, so we do want people who are either symptomatic or who have been at one of these exposure events to be tested. If you are not symptomatic or have not been at an exposure event, please stay at home. That's the most useful thing you can do for getting ahead of this outbreak under Alert Level 3. As always, if you have symptoms anywhere in the country, you should stay at home, call Healthline, and they will give you very clear instructions about where and how to get a test. And a reminder that this particular strain, the B117 variant, which originally was identified in the UK, we have seen this muscle aches as a common symptom rather than traditional respiratory symptoms, so do keep an eye out for those as well. Just in terms of travel in and out of Auckland, it's generally prohibited at the moment, as you would expect under Alert Level 3. So the most important thing Aucklanders can do to help stop any further spread of this virus is to stay at home as much as possible, work from home to the extent that you can, and certainly really stop any interactions with others outside your home. So I want to thank Aucklanders who really are doing this for the whole country and putting the greater good over your personal circumstances. There are, of course, exemptions for travel across the Auckland border. Work-related ones, of which there are many, are coordinated by MB. There are also some permitted reasons for individuals to travel, for example, if they are moving house or have to attend a healthcare appointment. We've to date confirmed with 1,637 people that their activities are permitted and that travel is permitted under the current arrangements. Likewise, there is an exemption process for special personal circumstances to travel, and to date, and the Ministry of Health coordinates that. To date, we've had 1,381 exemption requests. 857 of those have been fully processed, and the teams are working hard to get decisions back to people. The outstanding ones, all those ones that have been processed, the decisions have been communicated. Now, I should say that almost no exemptions are being granted for weddings. A number of exemptions have been granted for funerals and tangihanga, but only for immediate family members or equivalent. And I understand that will be distressing for grieving family members and others in extended family or friends, and thank you for your understanding there. Just in terms of travel through Auckland from one side of the boundary to the other, it is only permitted when travelling to and from work and home. So just letting those people who think that they can transit Auckland to go on holiday either north or south of Auckland, very, very unlikely you will get that approved as an exemption this week. Our community providers are continuing to visit homes of isolating families where they need support. These are welfare checks to assess families' needs, make sure they have everything they need to be able to remain isolated safely, and of course to get access to testing. If necessary, they can access translation services and have access to a number of different languages translating key information. Just in terms of that exemption process, back to that, all the exemption processes are available on the Unite Against COVID website. Quick update on contact tracing. Of the 1,855 people from the school, all bar 4 have had at least one test result returned, and the other 4 have got management plans in isolation plans in place, and there are about 50 whom we're just waiting or following up the second test results from staff and students at the school. Again, a large group, and I want to thank everybody there. At the MIT, there are the 21 close contacts of KCM. They are all isolating and being tested, and so far the results from that testing, which is being done at the correct time, is all negative. The dates and times of interest are up on our website. The vast majority of the people who were on the campus at the same time as KCM are casual contacts, and the instruction to them is to, of course, be at home because it's alert level 3 and watch for symptoms. So you should limit your movements and interactions with others while you are doing so. In terms of city fitness at Hunter Plaza, there were 158 folk identified as possible contacts. They are classified as casual plus. They are being followed up by contact tracing teams to ensure they get a test and are isolating until that test comes back negative. And the KFC Botany Downs contacts, the 11 close plus contacts as they were categorised, 10 have returned negative results so far, and the other, we're just following up that test result. Thanks again to the wider Papatoetoe school community, have been fantastic in responding to the call for testing. And finally, another busy day at Healthline yesterday. More than 4,000 calls were taken. Half were to the dedicated COVID-19 information line. Waiting times average 26 minutes, and they have Healthline has 4 times the usual number of staff rostered on. And just a reminder to people, if you want general information, for example, about testing sites or whether you were at a location of interest, please use the websites rather than ringing Healthline. And finally, huge thanks from me to everyone involved in the response here, lab technicians, their supervisors, contact tracers, public health officials, DHB staff, testing centre staff, working effectively around the clock on the response, and thank you for your support with that. I'm open to questions.
Can you please outline the communications that officials had with Family 3, or was the family, in which case Al was injured?
Well, I don't have the detail of the communications that the Public Health Unit would have had. However, I am aware that all members of the school community received at least 3 letters, one on the 14th, one the 17th, and I think the further one on the 19th. And having seen the content of those letters, it's very clear about what the expectations were on families. And I can also say that with this particular family and all the families where there were students who hadn't been tested by the time we got round to last Monday, there had been multiple attempts to communicate with both that family and others, including phone calls and texts and so on, and efforts to get alternative phone numbers to get in touch.
Do you accept there was any inconsistencies about the information given to families, and we have to have the context too, that there was information coming from the school, coming from officials, from the website. Are there any inconsistencies at all with what these families were being asked to do?
Look, I don't think there were any inconsistencies. I think we were very clear about what the message was to the school, and I think we can point to the fact that over 98% of students had had a test before they returned to school last Monday. So I think it was very clear what the message was to the school community and what the expectation was, in fact the requirement was on students. So I would look to the fact that actually, and again, this is a large school. It's in my experience, this is remarkable that we got that high level of support and cooperation from those families, and I think it is a testament to the efforts the school went to and the public health unit went to, and to get good information out to families.
You've said that you're not that keen to make referrals to police. You don't want to create a culture of fear or making people reluctant. But at which point, especially given, say, the coverage around this particular case in the future, are those expectations stepped up for people who are getting the information but still break the rules in terms of how proactive you would be referring those health orders to the police?
Look, I think what's happened in this case is a salutary reminder to all of us about what can happen if people don't follow advice. And that's not just these whānau. There are a number of things that we all, or that Aucklanders need to be doing, and needed to be doing previously under Alert Level 3, that perhaps not, that we have all not necessarily been rigorous in doing. And I think this is the point that the PM was making yesterday. Actually, it's important we both hold each other to account, but also support each other. And the idea she came up with yesterday, if you see someone who's on public transport who doesn't have a mask and you have a spare, why not offer it?
But will there be an extra level of government enforcement? I mean, the community and peer pressure is one thing, and we've seen it work in compliance, but at what point does the government step up its enforcement and send that message that actually these are legal requirements in place and they're being breached?
Well, they are indeed legal requirements, and in fact the alert level changes are of course underpinned by a legal order. I just want to go back to what has served our country well over the last year is by everybody doing their bit. We cannot police everybody's behaviour, and the campaign that lies behind our efforts is Unite Against COVID. It's not let the virus divide you. Okay, we actually need everybody to do their bit, and I'm still firmly of the view that that is really fundamental to our both success today and into the future. And I confirm that I would be concerned about a punitive or an enforcement type approach actually deterring people from either coming forward for testing and or volunteering information.
How frustrating are you that... Were there any Section 70 orders in place against any of the contacts in this cluster, be it family members of public students, anyone, during the time when we were to level 3?
So when Alert Level 3 came off and Auckland went into Alert Level 2, there was an order underpinning that. I did a... Yes, there's a separate order that is... so when we moved from a 3.2 to a 2.1, that's a separate new order. So that's the legal basis for Alert Level 2 and Alert Level 1. The requirement on the school community was articulated in a letter, and so that's an expectation of the Public Health Unit. From last Monday, when the school was closed again, after we found that additional case and students were asked to be retested, yes, I signed a Section 70 order that effectively was a separate legal instrument to underpin what the requirement was on the school and its community from last Monday.
So before that, there was no legal requirement for these people to, for instance, self-isolate if they had been asked to or requested to anyway?
Well, there's a legal requirement in the sense that they had been asked to by a public health unit, and that advice and that request is from a medical officer of health who is a designated officer under the Health Act.
Constitute a Section 70 order, like could you prosecute on that?
Well, I'll just go back to my previous comments. We were not intending to prosecute people.
But what I'm trying to get at here is whether the settings are actually in place for enforcement or legal requirement.
Well, the settings were in place for our public health unit contact tracers to be calling families, for that detail to have been shared by the school with the public health unit and the contact tracers, so the families could be following up. So in a sense, they can't do that unless they have a legal basis for that. And that legal basis is from the medical officer of health being designated officers under the Health Act 1956.
So when the contact tracer calls someone and says you have to self-isolate, that's not a Section 70 order, right?
That's a requirement that has been put on them. If they then don't comply with that, then the medical officer of health can require them to, and if necessary, issue a Section 70 order. So that's how it works.
It sounds like there was a time here when there wasn't quite a legal, there wasn't strictly a legal basis for asking these people I'm not saying it was unlawful to ask
Yeah.
them to self-isolate. I'm saying that you couldn't legally enforce it.
Well, there was a legal basis for it, and that legal basis is the designation of the medical officers of health under the Health Act, and that they can then ask or require people to do things as part of, in this instance, preventing further spread of a communicable disease. If a person is not complying, then they can issue a Section 70 order that can allow that person to effectively be detained in order to comply with the direction of the medical officer of health.
How frustrating is it for you that there seems to be uncertainty around the rules by some people?
Oh, look, I think it's frustrating that what has happened in this instance has had such an impact, and I can understand why. I think everyone is frustrated about that. So saying, I think our messaging has been really clear about, and was clear through Alert Level 3, Alert Level 2. The vast majority of the Papatoetoe High School community, a large community, understood that message, and the vast majority of students and staff were tested because they understood that message. So I think the communication was clear. And again, just going back, this is a school of over 1,400 students and staff, and actually the level of cooperation was, I think, remarkable, and I think we just need to point to that.
Given that there were some people who said that they didn't get that message, particularly perhaps around language barriers, will you be looking at making changes to the way that you communicate in future, different languages, different platforms?
Yeah, look, all the information that went out is available in a range of languages and did go out in a range of languages. I think that there are a range of channels used, and clearly the vast majority of people, and there's a very broad ethnic representation, multi-ethnic representation in the school. So saying, we'll always look and review and see if there are things, and that's why it'd be really useful for us to talk to the families and find out. I dare say it's not uncommon for school students not to pass information on to their parents. For those of you who are parents, it may be used to finding notes in the bottom of bags, even from a young age. And so whilst the information may have been going out, for example, via text message to students, it may not have been being shared with parents. In most instances, that was fine, and students were going and be tested. We just had a gap here, and we need to see, was there anything else we could have done?
Can I ask you on the topic of locations of interest, can you run through for me how you make the decision on whether to make a location of interest public, and when you decide to withhold that, and whether that's been done in any of these, in this Papatoetoe cluster, in this February cluster?
Yes, we will keep a location of interest. We won't publicise that if we are confident we have been able to or can contact everybody who was there. So there's a difference between, for example, a Kmart or a KFC or a McDonald's, when there's no easy way to identify everyone was there, who was there. A medical practice where they have a record of everyone who was in perhaps the waiting room at that time, we don't necessarily need to publish that as a location of interest. And I think you might be aware, for one of these families there was a private viewing of the house, not a public viewing, and the small number of people who were there we could easily identify and speak with.
Does that not rely on a really high trust model, though, that we've found in some people in this latest cluster doesn't work? Wouldn't it be better to put that information out? Isn't that a higher public interest value compared to privacy? Or how do you balance that?
Yes, so I think
not so much with a private home, but with some of the others, like Airbnb, for example.
Yes, sure. I think if people we of course rely on people to identify these events and these places. And then, again, in the case of a medical practice, we can talk with the practice and find out exactly who were the people who were there, the individuals, the families who were there at that period of time, and they will have contact details for all of those people. So we don't necessarily need to make public that place. Again, I think that's different from where events or places of interest might not have been disclosed. And I'll go back to what I said yesterday. There are usually three reasons. One is people genuinely do not remember, and it takes the third or fourth inquiry. Secondly, they might remember but just not think it's material, and so they don't disclose it. And thirdly, they may be bothered or fearful that if they disclose a certain event that may have repercussions. But that is, again, the professionalism of our contact tracers. Usually over time they are able to elicit this information.
In terms of the guidance for self-isolation, it's been pointed out to us that if you Google anything that has to do with that, you're brought to the Ministry of Health's self-isolation guidance page that hasn't been updated in 8 months. And this is the advice that you would get right now if you were to look at it today. It says that household contacts or casual contacts of cases only need to self-isolate if the close or casual contacts they live with is symptomatic. There's nothing on the page about casual plus contacts or close plus contacts. Is that still the advice, that you don't have to self-isolate as long as the person isn't symptomatic?
So that is general information, and I can see my media team down the back writing this down to make sure they have a look at that. That is general information, but of course when we're in a situation like this where we're at an elevated alert level and there is an outbreak, then the advice becomes more specific, and that's the advice people should follow. One piece of advice I would say I've asked the team to make consistent around the country is that anybody who is having a test anywhere because they are symptomatic should isolate until they get that result back. Now, there are clearly people who are asymptomatic being tested, like our border workforce, or people who are being tested because they are casual contacts or possible close contacts. Close contacts will be isolating. Casual contacts don't necessarily need to wait for that result to come back, but the public health unit will give them specific instructions.
And do you see why, I guess there's been a lot of confusion, I guess, over the last 24, 48 hours in terms of whether or not people should be self-isolating. One of the other things we've seen a lot of is people, after they get the tests, they get these forms that have three things. One of the boxes is supposed to be ticked on whether or not they're supposed to self-isolate, and more often than not, none of the boxes are ticked.
Yes.
Does something have do these procedures need to be tightened up?
Yes, actually, I saw there was some tweets about that yesterday, which I saw, and I immediately asked the team to look at that, and we've just had that conversation about getting that advice consistent. Anyone with symptoms being tested should be staying at home and isolating. The whole reason they're at home and being tested is because we don't want them to infect anyone with whatever illness it is they have. They should remain at home and isolate until they get the test result. Yes.
Just think on people being fearful to reveal where they've been. What's been done to mitigate that risk, or how concerned are you? Because we've seen an example and we've seen the consequences of this.
Yeah, so of course I don't know what the circumstances might have been with the family here where this wasn't initially disclosed, but I should say with the latter case N, this information was disclosed very quickly, and that was very helpful in terms of what we were able to then do and our response and what we do this week. What I can say again is that the nature of the interactions between our public health staff and these families are very important, and that they are very professional and expert at building a trust with them and, of course, supporting them. You can imagine it's a huge shock to get a diagnosis of COVID-19, and then suddenly all your entire life is exposed before the nation. So no wonder people feel somewhat stressed about that. But the fact that they do go back and keep working with whānau, look at FPOS transactions and go through all the information they can find just to elicit this information is critical to our success here. Sorry, just a follow-up question there.
Are there any concerns, though, about like a potential location such, maybe like a strip club? Is that something that you're concerned about? Is not being put forward at all?
I'm not concerned about it in this instance particularly, but of course, yeah, I mean generally, exactly, and people may be in relationships that they don't wish to disclose to others, let alone the general public. They may have been to places that could be a cause for embarrassment. So of course it has to be a really, really sensitive process, and again, it is a health-based process. And what we are trying to do is give people confidence that they can and should disclose information so that we can manage the pandemic. And this, again, may be another reason why we might not publicise a venue. If we are confident, we can find all the people who might have been there. Although I can say that there are no such venues involved in this particular outbreak. I'll go just...
One day of 0 cases, which is obviously good news, but does that, are you concerned that sort of as more and more days go on with 0 cases, you may struggle to justify the lockdown or enforce it?
I'm not concerned about that. I think I'm confident our thinking was good and our advice was good. We had a number of potential exposure events over a period of a week with a known infected individual, and we really, up till then, I think I know we were confident we were getting around the borders of and being able to identify the borders of this outbreak. It was clear when this further information came in over the weekend that there were too many exposure events for us to confidently know we knew where the border was without using an alert level increase. And so I'm comfortable. And it will be, of course, good if we don't get any new cases. The important thing here is we need to and want to identify any new cases so we can follow those up promptly as well. I'll just go down the back, sir.
Just jumping back to case, the parents don't have English as their first language, which we spoke about earlier. They say they didn't get the message. So in that circumstance, why don't you go and, I guess, knock on their door and get that message across face to face?
So there were a number of attempts to contact the family through different approaches, email and phone and text, I know. And remembering that just when that student in that family was tested was the Monday, that was quite a way down the track, and the day that most of the school who had been tested went back to school, and that student was symptomatic and then went and got tested. As it transpires, she had been symptomatic for a few days. And so, again, I think, you know, the message out to the school community, the reason the students weren't at school was quite clear. And so the fact that there wasn't a visit, I don't think was material in this instance. However, of course, we always go back and review and see, was there anything that we could or should have done differently? Follow-up question.
Following on to that, there are a range of different messages even now about what a casual plus contact in their household should do. Is that a problem?
I don't think it's a problem, because if people are in a household where there is a casual plus or a close contact, the public health unit staff will be in contact with them and will be giving them very clear instructions. And I just emphasise to people, follow those instructions. Don't worry too much about what the definition might be. The public health unit will give clear instructions.
Has anything actually fundamentally changed with this latest outbreak? Or is it more of a case of, say, the luck has run out? Because if you think about people not doing what they were meant to have done, that's more than likely happened previously in other clusters, and it just so happens that in this case there was someone who tested positive. So is it just that the luck has run out here?
Oh, I don't think the luck's run out, and you probably heard me say we can't afford to rely on luck with these with these situations. And it always amuses me when I hear people say, "Oh, it's all a basis of luck." Actually, we don't leave anything to luck or just being fortunate. Yes, you could argue that the fact that we had tested 98% of the casual plus contacts at the school, and it was one of the ones that hadn't been tested and who had been symptomatic for some days, you could call that bad luck. I prefer not to call it bad luck. The important thing was we had a safety net in place, which was you cannot go back to school unless you have a test. So the person was tested, we got the result, and then we're able to act accordingly. We're not taking any chances here. We're not leaving anything to luck. That's why we gave the advice about the alert level increase, and why we're continuing to work closely with the whānau to get around the edges of this one, down the back.
Are you pleasantly surprised that this hasn't been as transmissible as you feared at the beginning?
You mean this variant in particular? Yeah. Well, it's been interesting because what we've seen is high rates of transmission between the families, within families, virtually every family member being infected. But then outside of the families, it's quite unpredictable. So only one classmate of the original student, no one else outside the families, and then one of over 1,200 other students at the school. Just one was infected by that original case. So it's that unpredictability, and our sense that with this virus, the airborne transmission with this variant may be more of an issue, and that's why we're again being quite cautious, and that underlay some of our advice around the alert level change.
On vaccines, has there been a hold up with the vaccine awareness campaign? I think it was supposed to begin rolling out mid-February.
There hasn't been a hold up, but it's just ready. It's all ready to go, and we're just waiting to get that underway. But as you're aware, the first phase is with our border and MIQ workforce and their families, and that's going well.
So, but the awareness campaign wasn't meant to start in February?
I'd have to come back to you on that. Actually, I just haven't got the date in my mind exactly when it was due. There's no specific delay or reason for a delay.
Just following up on the case of the KFC worker. Surely after 15 texts or calls, you'd think that health officials would go, actually, we should go visit them in person, wouldn't you?
Well, remember that the school and our public health teams were following up hundreds, over 1,000 casual plus contacts, and our contact tracing team here was doing that as well. And we had seen really high responsiveness and levels of testing from the community. We were in that position, especially because it had got to the point where the school had reopened. There was a small number of students left who hadn't been tested. That's the point. They couldn't go back to school when we would have started visiting. And this person, again, had been symptomatic for some time, and I think the instructions around what to do, or for a few days to do if you're symptomatic, were also clear.
Do you think it was an oversight that there were sort of 15 calls and texts and nothing was done?
Look, it may have been an oversight, and that's why we'll go back and review and see, is there something more we could do, or what can we learn from this incident?
So the 4 cases that haven't been tested at Whakatautori, are they unable or unwilling to be tested? You said they're in isolation. What's the situation?
The only ones who haven't been tested, my understanding is they just weren't willing to take a test, but they've got a management plan in place. And remembering, their exposure would have been right back on the 10th of February, that exposure event, because they wouldn't have got back to school last Monday. So we're now, probably 20 days after that initial exposure, maybe not quite.
So
yeah,
they're
20.
refusing to have a test and
So,
will be in isolation 2 weeks before they're allowed to go back to school?
The public health unit will be working with them to determine when they are able to go back to school or indeed leave isolation.
Is it disappointing that you have people refusing to be tested in a school that's had active infections?
No, I'm not disappointed. I mean, I was actually, again, quite surprised it was just such a small number. We know there are people across the community who are not willing to be tested, and we see some come through our managed isolation facilities, some quite recent ones. So there are people who don't want to be tested. The good thing here is they haven't been back to school and they have been isolating with support.
Are they students or are they staff as well?
I understand they're all students. Yep.
And
Please.
on the source of, going back to the source of this infection, so what is the leading theory as to what happened here and how?
Yeah. So we've got some what appear to be equally unlikely sort of source investigations. We still think some sort of introduction through the mother's work at the Auckland Airport precinct is the most likely. But one thing that's a little bit that maybe speaks against that is that the girl in that family, the daughter, seemed to have her symptom onset slightly before the mother's. So that it's not impossible, but that's one thing. There is also we were looking back to a case right back in December at one of the managed isolation facilities. It had a similar-ish genome sequence for this B117, but we've tried hard to see if there's an epidemiological link between that case and these latest cases, almost 6 weeks later, without any evidence of community spread. That seems also very unlikely. So we're still puzzled about that, but we haven't stopped yet looking for that.
What's been done to stop people breaching their bubbles? And just sticking on that, are you confident there's enough adequate PPE for guests and staff at MIQ?
Well, I'm very confident on the latter. I haven't had any feedback that there is a shortage of PPE. We have very good stocks of PPE in the country. We have recently, of course, widened the use of N95 masks within MIQ, just as part of our protocol follow-up since in response to the B117 variant. And then I think your original question was keeping people in bubbles. Yeah, so one of the things we've done off the back of the Pullman Hotel experience was basically greatly limited the amount of time people spend out of their rooms. So there are very specific reasons they need to be booked, they need to be escorted, rather than people being able to come out for reasons other than very specific ones like exercise, or if people are smokers, to go outside for, at a specific time, or to get their health check or swabbing.
And just following on, just regarding contact tracing, recent ministry data shows we're still not hitting the 80% target for contacting people within 4 days. For non-Māori, it's as low as 52%. So why aren't we hitting that 80% mark, 12 months into the pandemic?
Yeah, look, I was just reflecting on this in the last couple of days. When and talking to Minister Verrill about this, when we set up our contact tracing system and those measures of success, it was in anticipation of it being deployed in a community outbreak situation. But of course, most of the cases we get now are in MIQ, and so the metrics for them look really odd against the compliance looks really odd against these metrics. And likewise, I think we are being successful with our contact tracing. You can see we are rapidly identifying close contacts. With our whole genome sequencing, we are rapidly working out the links between cases. So I've asked the team to go back and look again at those measures to see if they are actually giving us a real indication of whether the system is working as it should be now.
Are you comfortable with the way the system is working now, or is there a need to sort of shift the goalpost?
Look, I'm very comfortable with the way the system is working. It's just whether the current measures we are reporting on are actually ones that are telling us anything useful about the way the system's now working.
Those metrics, are you hitting those metrics for this cluster in terms of getting around everyone so quickly?
I don't know, and the reason I don't know is the data usually come through in fortnightly periods, so what we'll do is find out how it's performed over the last fortnight.
But I mean, there's some basic measures in there, like 2% within 2 or 3 days. Are you hitting that threshold for this cluster?
Yes, I would imagine, very much so.
And do you have a sense of how many, across all of the locations of interest, how many contacts there are, how many are being yet to be contacted, and how many are being tested or remain outstanding? Do you have a full picture?
Yes, I have a very full picture. I'm sorry I don't have that in my head, but what I would say is you'll remember for up until, right through last week, we had sort of broadened the definitions to capture actually over 2,000 close and casual plus contacts, and those were all being followed up with the daily phone calls and symptom checks and requiring day 5 and day 12 tests. So there were several thousand people being followed up as if they were close contacts, and that we were keeping ahead of that, which was good. Probably just really keeping ahead of that and delegating that work out to public health units and our national contact tracing centre here.
7,000 contacts.
Yeah.
All up.
Yes.
We're now a year on from our first positive COVID case, and it's been 4 months since the Simpson-Roach report. And one of the recommendations was making saliva testing common use as soon as possible. Why isn't it commonly used for us now? We've just hit March.
It's not commonly used because it's not yet clear how we would use it in our current response. We've got really good nasopharyngeal swabbing and PCR testing capacity. We know that's the most sensitive test, and in the situation we are in with a very, very low likelihood of a case in our border workforce or even out in the community, we want to be using our best possible test, and so that's the one we use.
Isn't it more, don't you have to take into account though that it would be much more comfortable for people to use the saliva test rather than the nasal test? Oh
yes, absolutely, no doubt. And that's why we're doing the trial of the saliva testing in our amongst staff in our quarantine facilities. It's voluntary, and we will get some information from that about acceptability, accuracy, I hope accuracy, and then whether it's possible to deploy that or useful to deploy that as part of our current approach.
But you don't have any plans at this stage to use it commonly because you just don't see how it could fit?
That's right, and the same with the rapid antigen testing. So again, because of the situation we're in, we want to give ourselves every best chance of finding every case. We're not in a situation where there is widespread community widespread community infection, and that's the place to use rapid antigen testing or saliva testing more as a surveillance mechanism. Here we're using our best test to screen people to find have they got the disease or not.
Just back onto contact tracing, do you know off the top of your head how many locations of interest were withheld for this cluster, and has it also been any consideration into making people who have COVID making it mandatory to give their bank statements or their Google Maps histories to contact tracers?
In fact, that happens already, just to your second point. So the contact tracers work with cases to go through all of any information they've got, including bank statements and so on, shopping receipts, whatever it might be. If they've been to work, card information, bus cards. So I don't know that we snap a card here in Wellington. I think there's an equivalent in Auckland. So all that information is used, and people are usually very good with volunteering that information. In this particular case, there's just it's not that locations of interest haven't been disclosed. They have been disclosed or talked about, but just not specifically identified where there was no need to do that.
And just on those cases where you've decided not to publicise the location of interest, do you know how many were withheld in this recent cluster?
Yes, so just in that recent cluster, the only location of interest that was where the address or the name of the place was withheld was the medical practice which Case C visited and was in the waiting room, and all the people there were able to be identified as were the staff, and so that's the only one in this particular outbreak.
Can I just follow up that? And so in previous outbreaks, has it been a common practice to withhold places of interest? Based on, because you were talking about a health responsible, based on that might be embarrassing to people or whatever?
Not at all. In fact, I can't think of one. And in this case, we did disclose that there had been a medical practice, but just not the specific name of that practice.
But there were a number of cases in the Northland cluster that weren't disclosed. A number of places that weren't disclosed.
Can you recall one? If they weren't disclosed, I'm a bit puzzled as to how that would be known. But what I can say is, if it's a place where the public have been, and there may be, for example, an Airbnb where someone has gone and the only people they met were the owners, and that's a very contained interaction, then we wouldn't necessarily publicise that. But I actually can't even remember any in the Northland outbreak off the top of my head. But happy to go back and have a look at that. Put it this way: it's not common practice for us to not disclose locations, and as you'll have seen over time, we've tried to do that more and more rapidly. So it's very, very in time.
Just quickly going back on the sort of language barriers. Are Southeast Asian communities understanding COVID messages, and how do you know? If they're not, what changes could you make?
I think that's a pretty broad question. I'll just go back to a couple of points I made. One is we do translate all the essential information, and we work hard to make sure it's translated into a range of languages. Second, yes, you've made a good point here where we have got, in this particular outbreak, people not from our Māori or Pacifica community, where we have quite good, our public health units have quite good contacts. They have Māori and Pacifica providers. They've got good contacts through community leaders. So one of the things I'm wanting to do with the team is go back and see, are there ways we need to develop and strengthen the connections with these communities, just to make sure we've got all the channels we can to make sure the information's getting out.
So are we missing those connections to those communities?
Look, I don't think necessarily. I've got, this evening I've got a call. I'm joining a call which is organised by the Office for Ethnic Communities. That's got, I think, between 200 and 300 people on that call. So, and I've done that previously. So we do have a program of trying to get out to these communities. This one will be in particular around the vaccination campaign. So we do have these networks we use, but I guess in this instance, it's worth us just going and seeing for our public health teams on the ground, are there other things we could be doing? Maybe 2 or 3 more questions.
Given your confidence in the ministry's communication with these families, would you be comfortable releasing the correspondence, or at least a timeline of what information was relayed when?
To this specific family?
Well, to the school families.
Look, my understanding is that the letters that went out from the school to the wider school community are already public, but if they're not, I don't see any problem with making those available.
And timeline of when they were sent, etc.
Yes, the dates they were sent, they'll have a date on them. Yep, that's fine. And I should say, just to go back to your point, I'm confident we were doing a good job, but of course we always go back and review and see, was there anything we could have done better and how could we improve it?
In regards to the 15 text or calls to the KFC worker, do you know of any other situations where families or people were contacted upwards of 15 times, but by luck of the draw didn't test positive for COVID?
I don't off the top of my head, no. I'm sorry. Yeah. I'll take 2 more.
Can I just clarify, is Case L a sibling of a student or also a student at Papatoetoe High School? Case L.
So Case L is an older sibling of 2 Papatoetoe High School students. The younger one was the one who was the infected one. It was a casual plus contact. And then there was another sibling who had also been at school but had then actually left school to take up a job.
And do you have an update for how many people as of today have had the COVID-19 vaccine in New Zealand?
There will be announcements about that tomorrow.
My question. So it's been noted that we need to be using different forms of media to reach new audiences, including TikTok. Would you get a must-see TikTok?
Is that a stupid question? Because of course we don't need anything other than the main media channels to get information out to people. Okay, it's a lighter question. I'm not personally planning to either open a TikTok account nor make an appearance on TikTok. I should say our team we've got a dedicated team around social media channels, and I should say that this time last year we didn't even have a Facebook page for the Ministry of Health, and we now have huge numbers of followers and people that are actually, I think, looking at that content and use it to help inform their decisions.
So would you dance if you thought that was helpful?
It's the Prime Minister who dances, especially when we get a series of zeros. Thanks very much, everyone.
Would you be open to official COVID messaging being got through TikTok?
Definitely not Tinder. Look, what I would point to is you would have seen some of the messaging to the big music festivals at New Year's and some of the more recent festivals. I was very happy to be able to support getting that message out in formats that I understand, talking to my children, resonated with people younger than myself. Thanks very much. Okay.
She used Tinder previously to get messages out.
I feel like I'm going to